therapy. All of these standard psychiatric approaches to patient are employed in psychiatric orgotherapy. I use antidepressants when necessary. I use neuroleptic drugs when necessary. I do everything that I learned in my psychiatric training when treating a patient. The difference is that I think that I have a range of activities and weapons with which to deal with patients which many other psychotherapists do not have. It's very typical for our trainees in psychiatric orgotherapy who are doing their residencies to say to us, I am so happy that I have a larger armamentarium than those people have. And an interesting experience was a girl that I treated a long time ago, a lady in her 20s who knew nothing about Freud, Reich, nobody. She didn't know anything about psychiatry. Her family physician referred her to me, and I thought she'd be a good candidate for therapy, so we did orgotherapy. And she did very well. And many months later, she came in, she said, you want to hear something? I said, what? She said, I have a girlfriend who went to a psychiatrist, and all they do is talk. And that's the difference between what we do and what most other people are doing. From my point of view, what orgotherapy enables me to do is to reach into places with patients that no other therapy can avail me, give me the kind of entree that psychiatric orgotherapy does. Thank you.
Thank you, Dr. Herskowitz. I'm thinking we have two choices. The first would be to discuss the paper, and certainly we have to do that. The second would be, since if I look around, we all do not know Wilhelm Reich personally, and I have been told that you know him still, and I think it would be important for for all of us if you just give us a few remarks about his way of appearance and personality and working.
Okay.
Would you agree? Yeah. Okay. I think it's an opportunity for us to have you.
Sure. It's interesting that I'll tell you how I came to orgotherapy. I was interested in psychiatry from the time that I had an argument with a neighborhood intellectual when I was 16 years old. And he said to me, you don't even know who Freud was, which was true. So I read Freud's studies on hysteria at age 16, and I understood this much, but it was fascinating. So that's how my interest in psychiatry was generated. Then I thought that I wanted to go into psychoanalysis. And I was taking didactic courses in psychoanalysis in Philadelphia. And I knew many of the prominent psychoanalysts. And I couldn't find one that I felt that I completely trusted myself with. So I'd been looking around for a psychoanalyst. And in my coursework, I would ask questions and I would get answers which wouldn't completely satisfy me. But I thought, well, this is the state of the art at this time. Many of the things are clearly correct, and you have to take the bad with the good. And maybe as time goes on, psychoanalysis will develop further. And at that time, an acquaintance of mine said to me, I read a book that I think you'd be interested in. I said, what is it? He said, Sexual Revolution by Wilhelm Reich. And I said, oh, that guy, he's nuts. He said, how do you know? I said, everybody knows he's a nut. He said, don't you think that you might read a book that he wrote and see whether you think that he's nutty or not? So I gave him that privilege of reading Reich's book. And there, in Sexual Revolution, I read the answers to some of the questions I had asked my psychoanalytic mentor and whose answers I'd been dissatisfied with. So I proceeded to read all of Reich's books that were available at that time, and the therapy made immense sense to me. So I said, this is the man I want to go into therapy with. At that time, Reich was in Forest Hills, New York. So I called and made arrangements.
What time was it?
This was in the late 1940s. Yeah. So I called and made arrangements and went to see Dr. Reich. He lived in a very nice, substantial house. And at that time, what I had read about orgone energy, that seemed very strange to me. So that was something I wanted to avoid when I talked to Reich about my personal therapy. And I was waiting in the waiting room, and Reich came down the stairs, dressed in a lab coat. And my immediate feeling was, he's playing the orgone energy scientist to impress people with his lab coat. But the impression of the man was immense. Like, my immediate impression was, this man is like a battering ram. There was a force about him.
What's a battering ram?
Rambo.
There was a force about him that was undeniable. So we started to talk. He talked about my background, my training, what I had read, what symptoms I had, and he told me, if I take you on in therapy, you must sign a paper saying that if I want to hospitalize you, you will agree to be hospitalized. I couldn't see that that would eventually happen, but I thought, okay, if I have to sign it. And actually, he never gave me a paper to sign. I never signed such a paper. And he said, well, therapy is always provisional. If I decide to stop therapy, or if you decide to stop therapy, so be it. It is a provisional arrangement between the two of us. And he said, when you come to therapy, you're a patient. You're not a trainee. You're a patient like every other patient. You may become a therapist, you may not, but right now you're a patient. That was agreed. The man himself he had a force, an energy like no one else that I ever saw. He had a very large head, and he was always serious. One never talked trivia or little commonplaces with Reich. Whenever one went into a session, one kind of straightened up emotionally and was prepared to be serious and as deep as one could be. In therapy, I figured out later that he had a way of dealing with patients to kind of keep patients off balance. For example, once, at that time, I paid him $50 per session. And at one of my sessions, he said, the fee will be $100 from now on. And I said, okay, because I'd be willing to pay $200. And I went down to his wife, Ilse Ohlendorf, and I gave her $100. I came in for my next session.